project is using web-based database management for a patient navigation center for African American in South Carolina.
So part of our program is serving the medically underserved in South Carolina, and this population traditionally can be hard to reach. So as part of our program, we developed a web-based tracking database to create a patient-centered medical home environment for the patient and the clinic. So it enables the patient navigators to track the patient throughout the process, as well as providing the clinic real-time access in the database as far as where the patient is in the screening program.
So we decided to start this project as we started our patient navigation. We know that patient navigation is very important to helping patients being screened and navigated throughout the program. And what we knew is that sometimes they get lost to follow-up, and we wanted to have a really good systems to making sure that our patients were not lost to follow-up and that their medical home was able to track where they were at. So that's how we developed a web-based mechanism so that we could enter patient data, we could query our patients, and that the clinics could also access their patients' information at any given time. And this allows us to provide uninsured and medically underserved patients the same care that an insured patient would get.
So what we do is we do have word of mouth, but the primary resource is actually through free medical clinics and federally qualified healthcare centers across the state who have an agreement with the center that we will come into their clinics. We actually get referrals from the primary care provider. This is an open access colonoscopy program, so patients really must be asymptomatic and not have any kind of GI symptom. So we review the records to determine appropriateness, and then we contact the patient and determine if they're eligible through a patient interview over the phone. If you want to develop a relationship with someone within a community where there's already a trust base, we work with faith-based organizations, we work with churches and federally qualified healthcare centers and free medical clinics just to get the word out. If they're wanting to get a screening program established, that's where you have that conversation with your gastroenterologist in your area and local gastroenterology providers like freestanding endoscopy centers or outpatient surgery centers. Our program relies heavily on that. All of the gastroenterologists in our program statewide donate their services and are not compensated at all for the care that they provide to this medically underserved population.
First of all, Dialogue for Action has offered us so many opportunities to network with so many other representatives from other states, other programs, people that do great things, and a lot of what we do stems from ideas that came from here.
What I love best about the poster presentations and the discussions are it's the deep work that's being done. It is what is boots on the ground and what we're doing to prevent cancer. All the people that are advocates and policy workers and community health workers and patient navigators and providers. And without that, we could not be making the changes that we're making in our community today.